This is an anatomy review of the lumbar spine for thorax 1. So the motions that we're going to see at the lumbar spine include flexion and extension. You may hear some people describe hyperextension of the lumbar spine, but we are primarily going to stick with flexion and extension. You're going to see lateral bending or side bending, as well as rotations. And our primary motions in the lumbar spine are going to be flexion and extension, and that's because of the orientation of our facet joints within the lumbar spine. So we're going to review the anatomical landmarks on a lumbar vertebrae. So we're going to start with the body of the vertebrae. So that's going to be the anterior portion of our lumbar spine. Our neural arch is going to be the posterior component of our lumbar vertebrae. Our vertebral foramen is going to be posterior to the body of the vertebrae. This is also referred to as the vertebral canal, so this is where our spinal cord is going to be. Our pedicle is going to connect the body of the vertebrae to the neural arch of our lumbar spine. We have our transverse process, which is going to be lateral. The transverse process is where the lamina and the pedicle meet together. And this is also a spot for a lot of ligament and muscle attachments as well. Our articular process, this is essentially where our facet joints are going to articulate with the vertebrae above and below. And the lamina is going to connect our articular process with our spinous process. So this is all on the posterior aspect of the vertebrae, and then our spinous process is going to be the most posterior component of our vertebrae. And this is what we palpate when we're looking at the lumbar spine. Next, we're going to talk about the intervertebral disc. So the intervertebral disc is going to be between our two vertebral segments. We're going to talk a little bit about the anatomy in just a second. Our intervertebral foramen is going to be that space on the posterior lateral aspect of the vertebrae, and this is where our nerve roots are going to exit from the spinal cord. And we have our facet joints. So this is going to be our articulation between the articular process of the vertebrae from above as well as the vertebrae from below. Moving on to our intervertebral disc. The intervertebral disc is made up of the annulus fibrosus as well as the nucleus pulposus. This is a relatively avascular structure, and there is limited innervation of this structure. That's not to say that there isn't any innervation at all. It's just that it is not a strong bundle of nerves that innervate this structure. It is considered a load-bearing structure. It restricts intervertebral movement. It provides stability to the spine, and it preserves that anatomical relationship between the segments within the spine. You can see with this image here, we do get a lot of movement and change in the disc with loading and compression. So the disc is made up primarily of water, but it is also made up of collagen and proteoglycans as well. These images here are meant to illustrate the structure, particularly of the annulus. So if you look at the orientation of the fibers within the annulus, you'll see they're all oriented in different directions. This is primarily to increase the tensile force of our intervertebral disc so that as there is load and as there is compression, it can withstand some of those pressures. Okay? I also wanted to illustrate kind of this cross-hatching to show that, again, the fibers are oriented in many different directions, and that provides a lot of stability for the disc. This is just, again, another illustration to kind of show we've got our nucleus pulposus in the middle. And again, during compression, during loading of this disc, the nucleus is going to transfer its tensile strain to the outer annular fibers of the disc, as well as the end plates of our vertebral bodies. And our end plates are going to be basically the top and the bottom of the vertebrae, which will sit above and below our intervertebral discs. Moving on to our joints and our ligaments. So we talked a little bit about our facet joints, and we said that's going to articulate with the vertebrae above and below. Looking at our ligaments, we have our anterior longitudinal ligament. So if we look at a lateral view here, we see our anterior longitudinal ligament here, as well as a superior view is going to be on the anterior portion of the vertebrae. So it's going to be on the body of the vertebrae. Our posterior longitudinal ligament is going to be on the posterior aspect of that vertebral body. So looking laterally, we see it right here, and looking from a superior view, we see it right here, the posterior aspect of the body. We have our supraspinous ligament, which goes along the posterior aspect of our spinous processes, so it's going to connect several different levels together. We have our interspinal ligament, which connects one spinous process to the next, so it gives a little bit of stability to our posterior aspect of our vertebral body. And we have our ligamentum flavum, which you can see if we look laterally here is going to be on more of the posterior aspect of the vertebrae, and this superior view shows a good area of where it's attaching. So it's going to be on that posterior border of our vertebral canal, and it's going to be connected by both our anterior surfaces of the lamina here. And our ligaments are going to provide stability and support to our lumbar spine. Moving on to the muscles of the trunk, if we're starting on the anterior portion of the lumbar spine, we're going to start with the rectus abdominis. And our origin for this muscle attachment is our pubic crest. Our insertion is the xiphoid process, as well as the costal cartilages of ribs 5, 6, and 7. Its action is to flex the trunk, and it provides stability to the abdominal area. So essentially it provides stability to our lumbar spine. And it's going to be innervated by our 7 through 12 intercostal nerves. Moving on to our external oblique on the anterior portion of the trunk. Our origin is at the iliac crest, the pubic tubercle, and the linea alba. Our insertion is on the lower 8 ribs on the lateral aspect, and we can see the direction of the fibers in our inner external obliques, moving down and in towards the midline. The action when the external oblique bilaterally is activating, we're going to get trunk flexion and stabilization of our lumbar spine. If we only have activation unilaterally, so just on one side, we're going to get ipsilateral side bending and contralateral rotation. This is innervated by the intercostal nerves 8 through 12, as well as the iliohypogastric and ilioinguinal nerves. Moving on to our internal oblique. So our origin is going to be at the inguinal ligament, the iliac crest, and the thoracolumbar fascia. The insertion is going to be on the 8 through 12 rib, as well as the linea alba. We can see the direction of these fibers are going to be up and in towards the midline, so opposite direction of our external obliques. So the action, again, when this is working bilaterally, is to provide trunk flexion and stabilization. Working unilaterally, we're going to get ipsilateral side bending and ipsilateral rotation. And this is innervated by the 8th through 12th intercostal, iliohypogastric, and ilioinguinal nerves. Moving on to our transverse abdominis, the origin is going to be the inguinal ligament, our iliac crest, thoracolumbar fascia, costal cartilage of our last 7 ribs. The big thing to note with our transverse abdominis is that the direction of the fibers are going to be in a horizontal direction towards the midline. Our insertion is going to be down at our pubic crest, the abdominal aponeurosa, and the linea alba. And the primary job of the transverse abdominis is for stabilization of the lumbar spine. The innervation is going to be the 7th through 12th intercostal, iliohypogastric, and ilioinguinal nerves. Moving on to the posterior aspect of our lumbar spine and our trunk. So we're going to start with the erector spinae, And this is often a broad term used to describe a lot of the smaller muscles on the posterior aspect of the trunk. So we're not going to go into every small origin and insertion for this muscle group, but our erector spinae consists of our spinalis, which in this image they're just showing in the thoracic spine, but that would be closer towards the midline. Our longissimus would be just lateral to that, and then our iliocostalis would also be on our posterior aspect of the trunk. Moving on to our transversospinalis. This is often referred to generally as our multifidi, but it does also include several other small muscles like our rotatories and our intertransversarii. So there are a lot of these small attachments for this muscle group, and it's going to have its origin at the transverse process, and then its insertion on the spinous process of the vertebrae above. So the primary action when working bilaterally for this muscle group is going to be trunk extension. If the muscle group is working unilaterally, we're going to see contralateral rotation. And the innervation for this is going to be the spinal nerves at the level of the specific muscle that we're looking at. We're focusing on our lumbar spine. Moving on again to our smaller muscles on the posterior aspect of the trunk. If we look at our interspinals, we see that these are going to connect from the spinous process of the segment above and then the spinous process of the segment below. And their action is going to be extension of the lumbar spine, since we're talking about the lumbar spine, or whatever segment that they're attached to. And the innervation is going to be the spinal nerve. Moving on to our intertransversarii. So this is going to attach from the transverse process of the segment above to the transverse process of the segment below, and this is going to be present between every spinal level. The action of this muscle is ipsilateral side bending or lateral bending, and innervation is going to be from the spinal nerve for whatever segment we are looking at for this muscle. So I apologize, there is a typo here, so this should say the quadratus lumborum is the last muscle that we're going to look at, and its origin is going to be on our iliac crest, and its insertion is going to be on the 12th rib, and then the transverse processes of all 5 lumbar vertebrae. You can actually see in this image they didn't illustrate a connection to our L5, so this would attach to all 5 transverse processes of the lumbar vertebrae. And the action of our quadratus lumborum should be lateral bending of the trunk. And this is going to be innervated by T12 and then the first lumbar nerves.